Today, we're diving into one of the most powerful and honestly one of the most controversial drugs in modern medicine, succinylcholine. It's a drug that can literally save a life in under a minute, but it can also end one just as fast. So let's get right into it.
I want you to picture this. You're in an emergency room. Your patient is crashing. They can't breathe, and their oxygen is just plummeting. You have got to get a breathing tube into their lungs, like right now. But their jaw is clamped shut. Every single second that ticks by is bringing them closer to brain damage or worse. What do? You reach for a tool that works this fast. In just 30 to 60 seconds, you get complete muscle relaxation. I mean, the absolute perfect conditions to secure that airway and get the oxygen flowing again. This incredible speed, well, that's the promise of succinylcholine. And that's why this drug is the cornerstone of a procedure called rapid sequence intubation, or RSI for short. Its only job really, is to achieve paralysis faster than any other drug out there, making it the undisputed champ in one of those terrible can't intubate, can't oxygenate situations. So, how in the world does it work so fast? Well, the secret isn't some kind of brute force. It's actually a brilliant and, kind of elegant chemical disguise that completely tricks the body's own systems. Okay, so here's the big idea. Your nervous system uses a chemical messenger called acetylcholine to tell your muscles to contract. Succinylcholine is, pretty simply, two of those exact molecules just fused together. It's designed to look like a friend. And this table just illustrates that disguise perfectly. So on the left, you've got the body's normal signal, acetylcholine. It binds to a muscle receptor, fires off a quick contraction, and then it's immediately destroyed by an enzyme. It's a clean, super efficient signal. But then on the right, you have our imposter, succinylcholine. It binds to the exact same receptors, but it's built to resist that enzyme. It's kind of like a key that fits the lock perfectly, but then it snaps off, jamming the whole mechanism wide open. So how does this jammed lock actually lead to paralysis? Well, let's walk through the 3 steps. First, it binds. Simple enough. Second, by holding that go signal on, it causes this brief, chaotic storm of muscle twitching all over the body. They're called fasciculations. And third, it just stays there. The muscle is held in that on state for so long that it gets exhausted and just stops responding to any signals from the brain. And the result is a profound paralysis. But that perfect disguise, it has a really dark side. The very mechanism that makes succinylcholine so incredibly effective is also what makes it so dangerous. This is where the body's own chemistry can be turned right against it. And here you see it. This is the cost of that speed. And this is not a list of minor inconveniences, okay? We're talking about severe, life-threatening complications. The top 2 on this list, hyperkalemia and malignant hyperthermia, that's the stuff of nightmares for anesthesiologists. Let's just focus on that first one, the potassium spike, or hyperkalemia. Now, in a healthy person, succinylcholine causes this tiny, tiny rise in blood potassium levels, about half a milliequivalent per liter. It's a unit for measuring this stuff in the blood. And on paper, that number looks completely harmless. But here's the betrayal. In a patient who has a major burn or a crush injury or a spinal cord injury, their body has actually grown extra receptors all over their muscles as a part of its healing process. So in these patients, that seemingly small potassium leak becomes a catastrophic flood that can stop the heart cold. The drug just can't tell the difference. And then there's malignant hyperthermia. This is a rare genetic disorder where, for reasons we're still trying to fully understand, succinylcholine acts like a trigger for this runaway metabolic explosion. The patient's temperature just skyrockets, their muscles become rigid, and without immediate aggressive treatment, it is very often fatal. So you can see the problem here. You have the fastest drug in the world for saving an airway, but it carries these absolutely devastating risks. And this creates a constant, high-stakes dilemma for the clinician who's standing there at the bedside. This table really visualizes that clinical tightrope walk. On the left, you've got the situations where its speed is just invaluable. But on the right, that's the absolute do not use list. The challenge is, in a real emergency, you might not know if your patient has a family history of MH or the exact timing of their burn injury. You have to make a decision in seconds with incomplete information, and the consequences are literally life or death. Thankfully, that calculation is changing. We now have safer alternatives, like a drug called rocuronium. Now, it's not quite as fast. It takes maybe 60 to 90 seconds to work, but it doesn't carry that same risk of those catastrophic side effects. So the modern question for clinicians is this: is that extra 30 seconds of speed really worth the gamble? Which brings us to our final verdict on succinylcholine. There is probably no better example in all of medicine of a true double-edged sword. You know, the source material we reviewed for this explainer summed it up perfectly with this quote. It's a phrase you'll hear over and over again from anyone who uses this drug because it just perfectly captures its nature: immense power balanced by immense risk. So, here's the bottom line. Succinylcholine offers the fastest, most reliable path to securing an airway in a dire emergency. It has saved countless lives, no question. But that incredible power is forever linked to a really frightening list of potential dangers, and it demands respect, caution, and expert judgment from anyone who dares to use it. Which leaves us with one final, pretty heavy question. In the highest stakes moments of medicine, when time is the enemy and every single choice has a cost, how do you choose the perfect poison to save a life?